Hello, and welcome to Psychedelic Chat. My name is Wendy Marusic, and I'm with Open Nurses, the organization of psychedelic and entheogenic nurses. Today, we have the honor of interviewing Dr. Hannah McLane. Dr. Hannah McLane is a physician, psychoanalyst, and entrepreneur. She is the founder of SoundMind, a Philadelphia and Oregon-based psychedelic facilitator training and research initiative aimed at bringing ethics, equity, innovation to the psychedelic ecosystem. Dr. McLane identifies as queer, white, able-bodied, and neurodiverse. She grew up in rural New Hampshire and spent several years in South America and East Asia. Dr. McLane researches cognitive diversity, psychedelic science, ethics, PTSD, and emerging alternative therapies for mental health issues. She attended McGill University and holds graduate degrees from Temple University in Communication Sciences and Spanish Language, Brown University, an MD in Contemplative Studies Concentration, and Harvard School of Public Health. She has a MPH in Global Health and Bioethics. She attended residencies in neurology and Occupational and Environmental Medicine from the University of Pennsylvania and completed a patient safety fellowship at the Philadelphia VA Hospital. She also completed a 5-year psychoanalytic training program, considers herself a relational psychoanalyst. Please join me in welcoming Dr. Hannah to the Psychedelic Chat.
Hi.
Hi. And for those of you tuning in live, please say where you're watching from. All right, Hannah, great to have you here.
Yeah, thanks for having me. So I love the intro. It's very dramatic. I feel like it's da, da, da.
Here we go.
Big deal.
All right. So, yes, why don't you start by telling us the trajectory of your career and how you got involved with psychedelics?
Yeah. Well, I think so. There's several different versions of that. It's like deciding which one to tell. I think so. I was driven into studying medicine, partly, I think, because of my history of trauma and my own experience with trying to understand like how to best help the world. And through my residency, really had the sense that I had spent like over a decade learning, and I didn't have the tools that I really wanted to have to help people with trauma. And then it was like at that moment, I was ending my, I was at the end of my residency, and I ended up going to a psychedelic conference, seeing an MDMA video with a patient, the SOAP conference in Pittsburgh, and really just felt like that would be the best way to address all the problems I was seeing, like in the hospital with people coming in, not having answers, and really just decided there. It was like my first psychedelic conference. Rick Doblin was there, and I like beelined it to Rick, and I was like, "Rick Doblin, I'm Hannah McLane, and I'm dropping everything. What do you need?" He was like, "Geez." Yeah. But I did. I didn't drop everything. I finished my residency. I finished my patient safety fellowship, but I did like make a intention. At that point, it was 2018 or 19.
Okay.
That
was recent.
Yeah. And I was sort of like in this, just like the throes of like, how is this institutional like chaos going to ever help anyone, and no time to like sit with patients. And I'd done psychedelics in high school, but never really facilitated, and have since like, had a very profound plant medicine journey. And now my parents are both have started plant medicine healing, which is really amazing. And I think most of us like don't get a chance to really see that, like the healing of our lineage, like through our actual lineage. I think when we do our own healing, we are healing our lineage, of course, but then actually seeing someone else go and heal theirs, and then it's like it really feels like a ripple effect that's occurring. Yeah.
Wow. So that was 2018 or 19. You decided to change your your path? And
yeah,
what were you doing your residency in at the time?
So I did neurology and then occupational medicine, and simultaneously was doing a psychoanalytic program, which is a 5-year training program. Yeah, it's funny because I basically was like, okay, like the next step is like training with like the MAPS expanded access program. So I like went and did that in Asheville, and I was like, okay, I just need like an office, I'll just need an office in West Philly, and we'll start doing expanded access. And it was like going from office to office, like looking at different spaces to rent and being like, okay, I just need a couple rooms and then a closet and then a safe that can be put in the closet that's locked because I'm keeping, my like a very illegal drugs in it. It's like
right.
The
Schedule one license.
Philadelphia were like, excuse me. And so then it became clear to me I would have to actually just buy my own space. And so purchased $1 million property with a loan. And I, at this point I was like, Rick, I'm buying a property. It's going to be like aimed at helping people with like MDMA and PTSD. And he was like, wait, but we don't even have the data back yet, Hannah, don't do it. Like, oh, we done a lot of like pushing people to get excited, but we don't have any of that.
Slow your roll. Yeah.
And I was like, I'm doing it anyways. And he's like, you're crazier than I thought.
Right. Welcome aboard.
Yeah, welcome aboard. And so I spent like 2 years in COVID trying to rehab this building in West Philly that was just it was a nightmare because it was, in COVID, the contractors didn't even want to be in the same building together. And it was like, you couldn't even order your heating system because like China couldn't ship things. And so it was a point in the middle of COVID that I was like, I need to just quit this whole thing. It's not going to work. And then it sort of, things started becoming clear that they were moving forward, and that we opened a couple years ago our ketamine clinic in Philly, and then have been doing ketamine assisted psychotherapy. And through that process of COVID, I launched a very small training program. And it was partly just because I didn't have any plan about how I was going to finish the rehab of this clinic. I was like, okay, I'll teach a class. Like I know Rick, I know Marcella, I know like a bunch of other people, Jeff Gus, like they'll come on, they'll teach like in a class. And the first version of our class was 2019. It was like 8 weeks, I think, $800, and 10 people. And I was just like, this is great, and so many of those people, the feedback was like, this was the best class I've ever taken in my life.
Wow.
Like, what did it? And I think I ascribed the success of that partly to me having ADHD and dyslexia, that I was like, I'm always bored in school. I've always been just like not learning and just like, this is not for me. And so I really have like the way I teach is I think about all the different ways that people can learn, and I make sure that we're keeping everyone in mind. And then it grew from there. I was like, okay, we'll do 20 weeks and we'll do 20 people, and then we'll do 30 weeks. And it just grew. Now it's 85 people. It's a year-long training program.
Wow.
250 hours. I think it's the longest one. And that's really the only product we have. I don't have like an intro class. I don't really have anything else. It's just like the class or nothing.
Right. And you have plenty of people wanting to sign up, right?
Yeah. And so we're licensed through, we're licensing people through Oregon, but we also, half the people are not in Oregon, are more interested in ketamine or clinicians that are in other states. So it really like runs the gamut from like teaching people MDMA, psilocybin, ketamine, and everything in between. Yeah.
Wow. So is your program completely online, or do you have some in-person too? So
we have the 250 hours are online, and then we have a required in-person at least 3 to 7 days. And then we also have every 2 or 3 months we're doing in-person meetups for our current students and alumni, which is fun. It's just we just launched that. So we have enough alumni and current students in New York, Philadelphia, Portland, and Northern California, and Florida is where we're focusing on in-person meetups. Yeah. Oh, that's wonderful. Yeah. How impressive, how quickly you got that going. Yeah, I mean, I guess it feels quick, but I think the bigger deal is that we're not venture backed, and that was like by choice. It's not that I didn't have venture people coming and saying that they wanted to back us. And I'm not like, entirely trash talking venture things because I have some VC friends that I respect what they do, but
Mm-hmm.
I think there's an amount of autonomy that we can have by not, we don't have any donors or investors. And so it's just basically like people pay for a class and they get the class and they don't get all this. I think when you have outside interests, you get something other than the education you're actually paying for. And so we're able to do exactly what we think is like most ethical and most important to teach people.
Right.
Yeah.
Oh, that's great. So in your training program, you have nurses involved?
We definitely do. Yeah, we've trained many nurses. I think we have about 250 graduates at this. Well, we graduate this current cohort in a month. This is really the first. This is the first one that's Oregon approved. Last year we had a 6-month training program. But yeah, so when the first class I taught, it was only licensed clinicians, like therapists, and then I started feeling like it was very limited for what the future would hold for psychedelic therapists. And it was like, wait a minute, all the underground people aren't licensed. They're the ones who know what's going on. The ceremonial people aren't licensed. I'd like them here. I'd love to have BIPOC representation being in West Philly. And I'm like, it's really hard to get that if you're only allowing in licensed therapists. And so I opened it up. That was in the end of 2019. And I was really the first one to do that. So at that point, I think the only training programs were CIAS, Fluence, us, and Psychedelics Today. And Psychedelics Today only had a short program. And then CIAS and Fluence were requiring only licensed clinicians. So when I opened it up to unlicensed people, it was very controversial. Now it doesn't sound like a controversial thing, but it was very controversial. It was a big deal. And it was like, okay. So like Rick Doblin and others were like, okay, like, this is what you think is the future of this ecosystem. And I did, but it was really interesting, like creating programming for different backgrounds. So we had some people that were like triple board certified psychiatrists. And then we had other people that were growing mushrooms in their basement in West Philly. And then we had nurses that are like, have this amazing medical knowledge, but don't necessarily know exactly like the terminology around therapy. And so we've really we've worked on creating this program that educates everyone. So some people come in and have a lot more knowledge in certain things, and then they can help others learn that. And then, when they get to the point that they don't know anything, then they get the receiving of the assistance. And I feel like for this ecosystem, nurses are super important. So both like RNs and NPs and like different levels of training. We do have an NP currently in our clinic who prescribes and does IM injections and is learning to sit as a facilitator. I think the medical knowledge is really important. And also it's interesting because it feels like the touching patients is like a really important thing that therapists don't know how to do because they're taught not to do it. And nurses are like, oh, I know how to comfort someone with touch. It looks like this. And it's like the therapists are like, oh, I've never done that before, So it's really cool to pair people up with different skill sets.
Yeah, I think nurses really, that's one of the very important things that nurses bring, that we know how to do therapeutic touch.
Yeah.
Right. And we're one of the most trusted professions, year after year, we're actually the top most trusted professions. But yeah, knowing how to touch patients. I mean, therapists are actively taught how not to touch patients.
Yeah. Right? And then they get they bottle up their feelings of empathy and they're like, I don't know what to do. And so then you have to they have to relearn how to use touch for comfort. And then even just the medical knowledge of when you give someone ketamine, it can look weird, like how slow they breathe, or sometimes it's like if someone pulls off their eye mask, they'll look like their face looks kind of like a zombie. And if you're not medical, it's like, what is going on?
Right.
And I think they're in our clinic, we always have someone medical that's like in the building for a first session, just to make sure that if anything weird goes on or someone gets agitated, that there's someone who knows how to deal with that. And then I would also say the other thing that I think needs to be implemented in all psychedelic training programs, which we're just starting to do, is is like moving human bodies, like walking them to the bathroom. What do they do? What do you do if they fall? Like, how do you hold them to walk them to the bathroom? Because we have like the bathroom train, which is great, but it's like no one's ever fallen. And also, like if you're trying to move someone in a session, like one time we were doing a training and someone just like sort of was very physical and rolled off their mat, and it's like we needed to get him back on his mat. And we had someone that was helping sit that was like jumped up and picked him up, and I was just like, oh my god, you're back. No,
right.
No, you need 3 of us, so
right. Yeah,
a lot of skills for
nurses are absolutely trained in that. I've done a lot of volunteering with Zendo, which is the psychedelic support at Burning Man, and it's very noticeable who is a nurse there, or how he can just walk somebody, right? Second nature, before they even know what's happening, they're already like safely, cleaned up or walked to the bathroom, or
totally.
We're just
very cool.
They have they before they even realize they vomited, the bucket's already under them, they're done. Like I'm an oncology nurse, so it's just second nature. Seamlessly before the person even realizes something's wrong, it's handled.
Totally.
Right? That's sort of a ninja superpower of nurses.
Yeah.
I'm glad you noticed that. So
nurses know how to move people. I'm looking at the comments. It's true, they do.
We do know how to move, and we move them safely and sustainably, because nurses do this for years at a time.
It's interesting because we do like a bathroom train, when someone is sort of still in the medicine. Sometimes they get with ketamine. So we work with psilocybin and ketamine, and soon MDMA, when it's out for everyone. But currently in Philly, we're doing ketamine, and often there can be like sort of just bladder irritation. So people mid-journey can be like, I have to pee. And you're like, you couldn't, because you just peed like 45 minutes ago, but let's go. And the bathroom train is like, you stand in front of the patient and they put their hands on your shoulder. So that if they fell, they could hold your shoulders. And then the back person holds their hips. So if they fell, you could potentially like grab them. And there was like a debate on our team, like, is the back person of the train holding the person in the medicine's shoulders or hips? And I was like, definitely hips, because shoulders, if someone drops, they're gone, They're
gone, right?
But hips, it's like, you got to know how to catch them. And
right. Ideally, you'd have a belt around their waist that you could just, right. Yeah. That's what we do in the hospital. If we,
totally.
Yeah.
Yep.
Or the, holding forearms. You want to hold bone to bone. Don't hold somebody's hand.
We can design a nurse-designed psychedelic fall risk and moving protocol. Let's do that. Open nurses and SoundMind.
Yeah, we could totally do that. Yeah. Instead of the bathroom train, even, I would say if you have 2 people, one on each side of them, holding like forearm to forearm. Because if I'm holding your bone, this is solid. I have you. People want to hold your hand, and it doesn't work.
Yeah, you're like, my hand's not going to help you, honey.
Hand's not helping. Don't grab me. I'll grab you, right? And
totally.
We can collaborate.
Cool
on that. So let's see. How do you envision nurses kind of in the future of psychedelics and therapy?
Yeah, I mean, so let's see. I would say that I think most people trying to get into psychedelics really want to sit for, facilitate. And I think that the major benefit of nurses is that they can be, right now we're at such an early stage of the ecosystem. The insurance companies don't even know what to do with like what is ketamine? Like who,
right.
we were covered for home ketamine until all the articles about Mind Bloom came out. And then I only had a couple people on home ketamine every other session for like financial reasons. And they were like, oh, we're not covering that anymore because that sounds dangerous. And it's like, well, it's not dangerous for us because we've been seeing this person for a very long time. We know them. We check every single lozenge. We make sure we know where it is. But okay. And I think the ability to have liability coverage and know medical and know how to sit for people is like a really important triad, I guess. It's like you can cover them. People know what it means to like be holding space, and also know what it means when somebody can't breathe, and like how do you do CPR? I think is really important, all of those things. So it's been helpful on our team growing the physical clinic, having the NP that we have recently added, just to have her be able to do all those things. It's like she's so multi-talented. And I think there's a lot of sharing too that goes on with like, okay, this is how we've actually in our training program just added a 3-month required like psychodynamic therapy prereq program. And so it's basically just like, what does it mean to hold space in a non-directive way? What is attachment theory? We're doing like a 2-hour module about like diagnosis, like what is DSM diagnosis, what is psychoanalytic diagnosis, and like filling people in so everyone's kind of starting more on the same page. And then once you sort of start people there, it's like then they have all these different skill sets, and the skill sets can lead to really dynamic teams, you know.
Oh, that's wonderful. So you have a 3-month prereq training that you run as well, and then the 1-year training.
It's part of the 1 year, so it's
part
3
of the
months
1 year,
and then 8 months.
So
Yeah,
it's the start of it, right?
Yeah. And I was worried for a minute that it's like we're going to start out and not talk about psychedelics for 3 or 4 months, and people are going to get bored and they're going to be like, what is this? But I mean, I think if you can't wait 3 or 4 months to start the psychedelic content, it's like, okay, like maybe a different program is better for you. You know?
Good to be well-rounded, and yeah, there's always stuff to learn, even if you think you know it. Yeah,
totally.
So, do you have any RNs at your clinic, or?
We don't currently, but we only have like 5 people. So we have 3 therapists, me, and an NP, and I think RN may be our next hire.
Yeah, I do know several ketamine clinics often hire RNs because they can administer the IM, right? Especially clinics run by therapists; they don't have someone medical in the building.
Totally. Yeah.
You can assess and administer.
Yeah.
Another role. So let's see. What advice would you give to a nurse who's interested in psychedelics? What should they do?
Let's see. I guess it depends on what you want to be doing. Because if you want to be like injecting ketamine and like sort of supervising situations medically, I think you're like totally set for that. If you want to be facilitating sessions, I think you can do that in certain scenarios. Like in infusion clinics, you're already ready for that. And in it depends on the model. In our particular model, we do more like psychodynamic approaches. So I actually reached out to my psychoanalytic training, the center in Philadelphia, and asked them. They have a 2-year training program, and I asked them, have they ever trained a nurse? I haven't gotten the answer yet, but I feel like they will if I convince them that it's important. Right. I'm going to send all the nurses to them.
Yeah, right.
It's like, it's 4 hours a week for 2 years. So it's not a ton of time, but it's like the basics of just like how you sort of talk about therapy. I would just say add some of the training around, just the logistics of psychodynamic training, and then you're all set. I think that's all you need. And I think, using the knowledge of touch and therapeutic touch and helping others in this space understand that is really helpful. Because there's like, I think it's been a learning curve for me to see what people need to learn at different educational backgrounds. And I think there's like a lot that clinicians know that non-clinicians don't know. And it's like, it's these like little details about like shutting the door, or like when you come in, or I don't know, even just like what you're wearing, there's like all these things that when you've been like in a clinical environment, you're taught, like, you don't show your midriff. You're like, probably if you're wearing a tank top, you probably have something over it, or like a scarf. And you probably, there's just certain things that we kind of learn. And I think that, I think it can be helpful to have more of us in the space, because it's like, we want it to be chill, and like, we want the psychedelic space to be a little bit different, but you also have to be a certain level of professional. And I think that that's something that's definitely like, already comes with the package, which is great. Someone's been trained as a nurse, they know how to like approach people, they know how to be professional, and also be like, okay, let me help you with your body, and that's something that takes years to learn, actually. So yeah. I just say like, keep doing. And I guess the other advice I would say is be patient, because I think with this, like the venture money coming in and then a lot of hype around certain companies and like, oh, this is growing and this is going public and this is like all the stuff and everyone's working. People get the sense that like you're like at the end and you like missed the train to the psychedelic career. And like, I just be really patient, because we're like at the very beginning and it feels like it's not, because it's like, oh, there's people that have been in this space for 5 years, but it really is like the very beginning of this ecosystem. Right. And it's like each state is going to start implementing different psilocybin laws, and MDMA is going to come within the next year or two. And like ketamine is going to like change more how people understand it and how people use it. And I think the skills of different skill sets will become more clear, like how useful they are. So I just say be patient. And if it's like not happening for you yet, it's because the systems are being set up so that you could then enter into the ecosystem as a like professional.
Right. Yeah. I mean, a lot of the stuff doesn't exist yet, right? It's not like, oh, go to school and then you come out and now you're a psychedelic therapist, right? There's no certification yet. That's, it's not even legal yet, other than ketamine, right?
Yeah.
So can you tell us some about the psilocybin work you're doing in Oregon?
Yeah, totally. So we were the third program approved to train Oregon facilitators. It was like a 300-page application, so we were very proud. We only have we have a 4-person team doing this, so we were like, wow. Thanks to Courtney and others on my team. And basically we have one program. So I would say maybe a little less than half of the people in the program are going for licensure in Oregon. The other half are not. And if you are going, at the end of the program, you have to take a test. It's not very hard. And we have to submit all your hours. You've done all the homeworks and you've done the in-person experiential. And then people have the ability to enter into the workforce in service centers.
Okay.
And again, I would say be patient with that, because there's only, there's been a couple that have been approved. And I think it will be a good 6 to 12 months to really see like how things are panning out. It's like one opens and they're still trying to figure out their financial model, and others are, and then other people are talking about co-op models. So we're looking at potentially partnering with different organizations. So it's not like you're plopping down a ton of money on something that is still being figured out. Because I think that is something that Synthesis did. They put $5 million into a property that then ended up getting zoned out. Like it was,
It was in
the county approved it, but it was too far away from a hospital. So it's like, there's a lot of unknowns, and you don't want to drop $5 million on something if you're not sure what's going on. So I think there's going to be this, just this slow, figuring out what it means in Oregon. Yeah.
So does any of your training involve psilocybin yet, or that's still not allowed? Or
Yeah. So right now we're doing, on Saturday, I go to Oregon for a week, and we're doing a ketamine training program for psilocybin facilitator. So we, currently you can't use, there's not a rollout enough of the service centers to really be able to offer psilocybin in Oregon. But I do find it really necessary to have trained with some medicine. And then we're doing a plant medicine retreat in Costa Rica in July. So getting more of direct experience if people want to do that now.
Yeah, that's great.
Yeah.
So do you ever worry about backlash from licensing agencies or regulations?
Yeah.
Our nursing boards are very punitive.
Yeah. And I think this is the other thing that I've been sort of telling people in the training program, that I actually opted not to get my medical license in Oregon because I was advised by a medical malpractice attorney not to. Because she said, if you want to work in the service center, it's actually better if you don't have your license here, because it's if you have your license, you have to really work hard to separate this is me prescribing ketamine and offering medical advice, and this is me in a service center, and I'm not doing any of that. And she said, if you can help it, don't get your license there and just keep practicing medicine in Pennsylvania and New York, and then do a service center in Oregon, and it keeps it a little bit more separate. That's not like an option for a lot of people that are already licensed in certain states.
Right.
But I am having one of my friends who is a palliative care doctor prescribe the ketamine for a ketamine retreat in Oregon for that reason.
Right.
I don't know how real the concern is. I think it's more like sort of theoretical, but also if you do have a license, it's I think Measure 109 has done a really good job to be clear that it's not offering medical or like therapy advice. And so you just have to make sure you're not like doing anything that's outside the scope of what a practitioner would do in that setting, and just keep the things separate, you know. So for instance, if I was in a service center, someone wanted to wean off SSRIs, I couldn't really explain to them how to do it. I'd have to send them to someone else who might be a medical person that could do that. Or I'd have to like see them at a different medical clinic outside the service center, but then it would be, you can't cross refer people. So it's just like, you have to be very careful that you're keeping your different practices separate. I don't really think that, I don't imagine that there will be a backlash. I think if there was going to be from licensing boards, I think we'd kind of know about it, because I think they kind of make themselves clear, like be careful. Although you don't totally know how they're going to react. Yeah.
Seems like everyone's kind of waiting and seeing, and you don't want to get caught in that. Yeah,
totally.
Right. So how do people respond when you tell them you're working with psychedelics now? You know, you had a sort of a career change a little bit. You ever get any?
I mean, I would say 3 years ago, people thought I had lost my mind. You know, they were like, "You're ruining your career." I think I'm still one of the only physicians. I mean, there's a few of us, I guess, that are really outspoken about it, but it's like there's not that many that are doing like the psychedelic assisted therapy approach. I would say now there's a lot more interest in like how to get involved. I've had, you know, several like former supervisors that are like, "Can I get treated at your clinic?" Or like the psychoanalysts at first were like, "What are you doing?" And now a lot of them are referring patients to me. I do think our approach is very psychoanalytic, and that we are thinking about all the different like ways defenses play out, and like how trauma gets processed. And so I think there's not that many clinics that do that. There's a few, but yeah, I think there's
an infusion center. A lot of the doctor-run ones are. They give you the ketamine, and then there's not much therapy, and people still get somewhat better. But
right, because it's like a long-acting antidepressant is how I kind of think of it. If you just get the infusion, but to me, it's like you're missing this opportunity to look into, you know, what caused the depression to begin with, you know?
Right. So how are you administering the ketamine? Do you have a basic protocol? Are you IM or sublingual, or how often do you like to see people?
Yeah, so we do lozenge and IM, and we see people when we first see them, we ask them to come in at least 3 times spaced a week apart. And then we take it from there. So some people keep coming once a week for a while. Some people 3 is enough. We don't really do one-offs, partly because you don't get the full benefit of seeing if it worked or not. And the other issue with like one session on its own is that you can sometimes bring up like trauma memories, and then you don't really have the chance to process them. So we find at least 3 to 6 is the best. And then we've had people that come in at once every 2 weeks for a year and are continuing to get better, and like just really, you know, I'm not going to keep treating someone if I don't think they need it. And it's like, if someone's continuing to just benefit and like digging into their unconscious and finding things and changing their life, it's like, okay, this is a good strategy. So we'll keep doing that. We are working on setting up like drop-in groups, so that it'll be like a half or a third the price of individual sessions for people that are on like a maintenance program.
Right. And then do you have integration groups or sessions too?
Yeah, we do have integration sessions. Right now we're just doing single people. So we do groups for training. So our ketamine training program is groups, and our psilocybin training program is groups, but our ketamine clinic is all individual. So the integration sessions are individual as well. And And sometimes we'll just, if we're seeing someone once a week, sometimes we actually do 3.5 to 4 hour sessions rather than 2 or 3. So we often tack on the integration at the beginning of the next session. So we say like, what's happened the past week? And we really designate a chunk of time to processing. And then we go into the next session. Like, what are your intentions? And then we do the ketamine.
Right. Oh, that's wonderful to have 3 to 4 hours is just a luxury of time. That's
It's like, it's partly my own, the trauma of working in hospitals. And they say like, you have 30 minutes with this person. You're like, I can't do this in 30 minutes. Like, I really can't.
Right. You just
so now, like, no one will ever tell me. Yeah. I don't know. Like, maybe at some point we'll be like, we have to start speeding up and seeing more people. But right now we're doing fine and working on different ways to make things accessible that aren't like cutting sessions short.
How to make it more,
and we do like a sliding scale. So there are certain people that get free sessions and other people that get, we have a limited number of those, but we are doing a lot for, working for access and creating programs around that.
Right. Oh, that's great.
I see Seth, who's our lead TA and trainer, is answering questions in the chat.
Oh, great.
Thanks, Seth.
So yeah, when we met at the Queering Psychedelics conference just a few weeks ago, I picked up this great brochure about the trans-affirming care. So maybe you can take a few minutes and just tell us a little about that. Such an important topic.
Yeah, totally. And Seth, maybe because I know you're there, maybe you can put in that link to the PDF for that because it's free. So we have Trans-Affirming Care in the Psychedelic Space is a free brochure that people can print out, and we bring them to conferences and give them out. I worked on it with Maya Fern, who's a trans woman, and basically it came out of conversations with her around the lack of support for trans people in the psychedelic space. And I think it spans both the plant medicine world and above ground. So in above ground, there's certain issues in that people don't understand pronouns, and they're not they're maybe not having representation of trans folks as facilitators, or not prioritizing queer populations. And then in plant medicine spaces, there is this interesting global recommendation people often get when they're going to an ayahuasca retreat that people say, go off all your medications, just go off everything. Don't eat salt, eat clean. And it's well, that's great, except for if someone's trans and is taking hormone replacement therapy, you actually don't want them to go off the hormones, because it's we all have internal endogenous hormones and we're not going off them, and it same thing happened with, I had a friend that has thyroid issues, and she was told to go off all of her meds, and then she was having thyroid
of course,
withdrawal symptoms, and had a terrible journey. And she was I felt terrible. I thought it was the ayahuasca, and turned out it's because I should have just been still taking my thyroid meds, So it was partly just realizing that there's a lack of education around that in the space. And so we created that just basics of what are pronouns, and what is inclusion, and who do you talk to if someone says to go off your hormones. And it's sort of developed into, in the fall, we're launching a queer leadership council, which is going to be 15 people that are meeting. I think it's going to be every 2 weeks, who identify as queer, trans, LGBTQ group, and really work to platform folks to become leaders in the space. And this also comes out of noticing that it's often the same voices at every conference of different marginalized people. And those particular marginalized people are kind of exhausted, because they're there are others of us. There's not just 3 Black people or 3 trans people in this whole country interested in psychedelics, but it's one name gets out, and it's oh, let's invite this person, and recognizing there's a lot of different experiences within these groups, and so really helping as much as we can. So we have a BIPOC leadership fellowship program right now running. It's on its 3rd month of an 8-month program, and Quest is heading that up, and there's 15 fellows, and that's a free program for people. And it's just helping people get their name out, understand how to push forward whatever their own agenda is, and really helping using our own internal resources to help push forward, creating a more level playing field for different groups.
Yeah, that's great. we're looking to get sort of a bank of nurses that people want to have. Like, we need a nurse at this conference because there's no nurses to
there's a lot of nurses like
around, but nurses who are willing and able to get up and speak too, just because you're
totally
to be in the spotlight there. Let's see. So we'll get to the questions shortly. Maybe what kind of self-care do you do? You're doing these 3-4 hour sessions. How do you maintain and recommendations you have?
Yeah, I would say I don't do it. I don't do as many ketamine sessions as I used to. I do like max 3 a week. Usually it's 1 because I'm mostly running the training program. Mm-hmm. But that's a lot, I feel like running 2 groups of 85 people is a lot of people. A lot of my self-care involves hanging out with my 5-year-old. Mm-hmm. It's just like the most fun, and just the spontaneity around art and music is like, what is going on? And then I play guitar. I love music and also meditate. And I come from like a Tibetan meditation lineage. And actually I am doing some projects around reciprocity towards Tibetan refugees, partly because so much of what I've learned in the last 20 years has come from a particular lineage that has helped me understand non-ordinary states in a way that I don't think I would have. So since college, or even the end of high school, I was starting to do 2-week silent Buddhist meditation retreats, and really started understanding non-ordinary states and how to work with them through that lineage.
Okay. So let's see. If you could go back and give your younger self a bit of advice, what would you do?
Is this a you question or an audience question? Oh my God.
It's kind of one we like to do sort of towards the end, and then we'll take some of the audience.
Yeah. My younger self. It's funny. I dyed my hair with henna yesterday, so my hands are very orange. I keep I don't know if it's clear on the show. But
that's great, right? They mentioned your shirt, yeah.
But I have no gray hairs, and I'm 42, so just so everyone knows, it's henna. Henna-ing dreadlocks is not that fun. But let's see. So my younger self, it's really hard. I didn't know I had dyslexia until I was 34. And I don't know if I would have, I think I would tell my younger self to not be afraid to ask for help. I think when I was even in middle school, I was staying up till 2 a.m. trying to get my homework done. And it sounds crazy because it's how did I get through med school? I don't even know. Mm-hmm. But I think there was even if I didn't have a diagnosis, I really wish I would have been a little bit more of a self-advocate around how long it was taking me. Because I think if my teachers knew that oh, you're staying up till 2 a.m., you could do half the math questions and still get the same amount of knowledge out of, the experience. I think there was a lot of just working to fit in and not being there's too much shame around I should know how to do this. I'm not going to tell anyone. It's I think if I would have realized earlier, it would have been a lot easier. I don't know. Who knows? You ask for accommodations later and no one wants to give you them. So I don't know if that would have been the same as an elementary school kid, but I think just not being ashamed of how you work would have been great. And I think my family, amazing parents that are just back to the earthers, New Hampshire, growing their own food. It was an amazing childhood, but they were we don't believe in labels, which I think there's a benefit to that. In that I didn't have a label that held me back. If I knew I had dyslexia and ADHD, I probably wouldn't have convinced Brown Medical School that that they should take me from the 2% of people that get accepted. I think I was just a little clueless about where I really was at. But I convinced them. And I think if I had this label in the back of my mind, I would have been nervous to go for something that big. But at the same time, it's it then doesn't help you understand what's going on. So I think if I had to do it over again, I would have reached out and just let people know what was going on.
Right. So I think the culture has changed somewhat too now that accommodations are more of a thing, and neurodivergence, is.
Although little known fact is that accommodations or ADA does not cover healthcare professionals, just in case anyone's in the audience that wants to, like, if you're thinking about asking for accommodations, don't, because a hospital, all they have to do is say they're nervous about patient safety, and they can not give you anything you ask for.
Wow, interesting.
And so it's like this. There's been Supreme Court cases in which this has been used, and so it's actually better to just get support from people around you and like learn compensatory strategies rather than asking institutions. I mean, some people have good luck with it.
Right. You could ask the university when you're in school, but not the hospital. You know?
Exactly. Yeah.
Okay, yeah. Okay. Well, maybe we'll start taking some questions from the audience. How did you talk your parents into doing psychedelic assisted therapy?
Oh my God. I'm now thinking of like launching a medicinal mushroom product with my dad, because he's just great, like a lion's mane turkey tail integration product. But let's see. So I was doing things like purchasing clinics that I could not afford, and like doing a career that didn't really make any sense to them. And so I was trying to help them understand. And so I think I sent my dad Michael Pollan's book and Joe Tafore's book, The Fellowship of the River. And he just got so like, he was so fascinated, and he was like, the plants are calling me, Hannah. And I was like, okay, can you just like chill for a little bit? He's like, so he was like signing up for random ayahuasca circles in New Hampshire. And I was just like, who are these people? Like, what? No, you can't just go to anyone. That's not a thing. And he's like, why not? And I was like, oh my God.
Yeah.
So I was like, fine, you can come to Costa Rica with me. We're going to like check out a spot where we might host events. And it's like some maestros are coming up from Peru. So he got like the benefit of being with like these really, really experienced ayahuasca people. But he went, and I think he'd never done therapy, and he's given me permission to share this, but he'd never done therapy before, because he didn't really believe in therapy. And later it became clear that it's not that he really didn't believe in it. It's that he knew that he couldn't get to the things he needed to get to. So he had childhood sexual trauma, and had a lot of like erasing of memories around that. And so he did that, and then he's done since a few different other ceremonies with different facilitators, and has been able to like bring back up those memories, forgive that person in a way that he was like, I had no idea that was like the thing, it was like the message was like, let it go. And now he's like retrieving the memories from the first 10 years of his childhood that he didn't have, which I had no idea. I was like, whoa, I was raised by a dad that didn't have, like, that just had erased the first 10 years of his childhood.
Right, wow.
And like happy memories, he's getting happy memories back. And so his transformation then like inspired my mom to be interested. Now she's like, they're totally transformed. It's just insane. I can't even begin to explain like how it feels, but just like,
it's wonderful.
And also just like your own parent resonating. Like I had exposure to formaldehyde as a baby by mistake. They like put in an addition on the house, and it was like toxic fumes that no one knew where it was coming from. And it was like very traumatic. Every medicine journey I do, I go back to that age. It was like 0 to 1.5. And it was like the medicine helped my parents see that as a trauma for me, which was, weird in itself as well, because you're like, oh, you're seeing me, you're actually seeing why I'm doing the things I'm doing. It's like a lot of what I do is coming out of that trauma, and they're like, oh, this is what you do. And I've talked to like Michael Minhofer, I've talked to Rick Doblin, I've talked to other people that are like, that was like actually what drove me, was like wishing I could get this for my parents, and I never got to see that, or I had to do it, I had to do my own work and like, help them, and I never got to see them heal. And I think I just feel so lucky that I'm actually witnessing my 72-year-old parents heal in ways that they couldn't for their whole lives. Yeah.
That's incredible. Yeah. Hopefully there's more of that in the future now that the knowledge is out there, things are becoming legalized. Yeah.
Totally. Yeah. And I think that generation's like becoming more curious, which is super cool. Yeah.
Great. All right. I'm glad to hear that you added the therapy module. Good idea. What kind of analysis did you study?
That's a great question. So I went through a program that was like, started with Freud and ended with, I became I consider myself a relational psychoanalyst. And I think I'm self-educating about Jungian things because Freudian institutes don't really talk about Jung, which is very strange. But it goes back to the history of like World War II and why Jung was brought in, and like there's a lot of like historical just like divide. But I would say relational psychoanalysis from like the 80s is what I would consider myself.
Okay, great.
Yeah.
All right.
A great question.
All right. Should NPs have collaboration with a physician in order to administer psychedelics? And what type of training is needed in order to provide safe care?
Well, I think it depends on what type of psychedelic therapy you're doing. So I would say some NPs, if you're like a psych NP and you've sat with people and you kind of have a sense of like therapy, then you probably don't need that much help. I think if you haven't had that much therapeutic, like any training in therapy modalities, I think it can help to have a collaboration with a therapist. I don't know how important a physician would be. I feel like if a physician isn't trained in therapy, it's like I don't know how much collaboration is necessary.
It depends on the state. Some states, NPs don't have independent practice; they're required to.
In that case, they have to, and then hopefully you can find someone that's aligned to your understanding of psychedelics. Yeah.
Right. Okay. Where have you been able to get liability coverage for ketamine in your practice?
Yeah, so we have like 3 different companies. If you email me, I can provide what the names of those. But we have like the physical and the personal and the entity, and then oh my God, there's like so many levels of then providing it in Oregon. We have event insurance. So if you'd like to know the names of them, you can email us at training@soundmind.institute and we can let you know those names. And just like also keeping in mind things shift every day. It's like every day something changes, or like we need this information, or like buy an EpiPen, for your clinic. It's like, okay, I'll buy an EpiPen.
Right.
I have an EpiPen,
Yeah.
Yeah.
All right. How much do you charge for prep sessions and integration?
Yeah, so we charge. So it's a sliding scale. Some people pay nothing. Some people pay middle, and then the top of the scale is $11.50 for a 4-hour session, and the medication, the medical intake is $3.50, and the groups will probably be less than half that.
Okay, and how much is your training?
So the training is $11,300
for 1 year.
Right? Yeah, for 1 year, 250 hours. That doesn't include the retreats, and the retreats are 3,000 to 6,000, depending on if you're doing 3 days or 8 days.
Okay, great. Okay, could you talk about managing your own intentions when approaching a session, especially in light of trauma inflicted by practitioners who didn't operate with the best intentions, like what was in the cover story podcast?
Yeah. I have a lot to say about this. I feel like I could talk about this for 2 hours. Let me take a drink from my water. So I do a lot of teaching around narcissism and psychedelics and cults. And part of it is that a lot of the research about boundary violations have found, well, not a lot of it, but there's been some like just research into like when did that happen. A lot of it is psychoanalytic literature, therapy literature. But it turns out that oftentimes the practitioner that made the violation fit into some sort of narcissistic spectrum personality, and part of that is that there's a sense of like, I am the one to heal you, like I have power. And I also think it's like people that are prone to, like people that feel very inadequate are the ones that are prone to using like this relationship to feel power and then abusing it. And so the way we train people is just to be really aware of like in yourself, like where are the needs for power? Where is the need for power? Where is the need for like where is your own shame? Where is your own feeling of inadequacy? And like, can you locate it and talk about it and process it with a supervisor or with a peer group? So a lot of it is bringing it out into the open and being like, oh, this made me feel this certain way. And if you can do that, that is what is then eventually prevents the boundary violations, because you're like, there's not this like shadow part that you're not connecting with. Once in a while, you'll get people that are like actually just going into it with intentions that are bad. And I don't know what you do with those people other than try not to pass them through training programs. But most people that boundary violate, it's like a slow boil that they didn't realize they were going to do it. And then they didn't have anyone to talk to. And then they were like getting into some like dynamic that was bad, So I think it's really important not to finger point, because the finger pointing is like, it's them, it's not me. And then it's like, then you're more likely to be doing something that you aren't aware of because you think you're, free from it.
Right. And supervision groups are a great way to, discuss what's coming up for you, right?
Yeah.
So, all right. I like the idea of fall prevention protocols. Do you have guidelines for management of hyperemesis? Do they rinse their mouth after they vomit, electrolytes, cannabis?
Yeah, so ketamine people don't vomit that much. We've had maybe 2 people vomit in like a year. It's like people get nauseous and like spinny, but we try, we basically just watch them closely. We don't do like people are lying on a couple pillows and we're just watching them, and usually you can tell if someone's like about to vomit. Sure, they can rinse their mouth. It depends on what they want. Electrolyte management, it hasn't been that big of a thing. We do Zofran before, and then if someone gets really nauseous with the lozenge, we'll do IM the next session. IM is less likely to have someone vomit. Although I think we may have had 3. I guess in a year or 2, we've gotten like 3 or 4 people that have vomited, and 1 has been on IM. Usually it's like beginning sessions, because the first ketamine lozenge session is usually the worst.
So you pre-medicate with Zofran, or
for everyone on at least their first session, if they don't get any nausea, then we'll give them the option the second time to try without it.
Right. Oh, we got a long one. Very into psychoanalysis and psychedelic assisted therapy eventually. What are good ways to get involved and increase exposure to the community while completing my psych NP in school for the next few years? So they're looking to get some more professional training versus personal interest, right?
Yeah, so I would say you could reach out to your local psychoanalytic institute. They usually don't happen within institutions like hospitals or universities, because they have developed separately. So you have to like search online what you're like what's around you. You could take our first 3 months if you wanted to do that as a training. And I would say you can, there's a lot you can do to just like with just reading books and reading articles. Yeah.
Right. Now we come to the Psychedelic Science Conference, which is going to be in Denver at the end of June. So will you be there with SoundMind?
I will be there. So we will have a table. I will be speaking on Wednesday about safety and safety and psychedelics, and I will be talking about narcissism and cults for about 15 minutes. And then Thursday, I have a session on ketamine-assisted psychotherapy, and then on Friday, we have a community room in which we're doing art, integration, and veteran peer support.
Excellent. So open nurses will also be at the conference. We will have a table on the expo floor, and then Thursday afternoon, we're going to have a little community room gathering as well for nurses. So all the nurses tuning in,
yay!
Be in Denver, come join us.
Cool. Sweet.
All right. Well, I think we're getting close to time here. Any final words? Anything you want to say to our nursing audience?
Let's see. I'm noticing Seth answering lots of questions. Good job, Seth. I love it. He's like talking about countertransference. Final words. I would just say like stick with it if you're trying to find your way in like becoming a facilitator and you're a nurse, it's like there will be a lot of opportunities, and just getting, reading about things, taking classes, and just like getting yourself out there, getting involved in any like political decrim measures, and just meeting people. There will be more and more opportunities, so don't give up. And yeah, I'm excited for ongoing collaboration with you guys.
Yeah, excellent. Well, thank you so much for coming on.
Thank you. I'll see you soon.
All right. Bye, everyone.
Bye, Wendy.
Hey.